So let's move on to the next group of anti-resorptives, which are estrogen, estrogen analogs, and estrogen receptor modulators or agonists. Estrogen is a sex hormone and, along with testosterone, has a key role in both bone growth during the growing stage of the body in both men and women, and also maintaining bone health during the later steady state stage. And when estrogen levels drop due to menopause in women, there is accelerated bone loss during the transition period. So the action of the different estrogens within the body on the different types of estrogen receptors is complex, but the mechanism of action of estrogen in hormone replacement therapy is primarily considered to be anti-resorptive. So estrogen in HRT is actually just as effective at protecting bone health as bisphosphonates, possibly even better. Around 20-30 years ago, it was even the gold standard for prevention as well as treatment of osteoporosis. However, it fell out of favor because of the concerns with breast cancer and thromboembolism, which was reported in the controversial Women's Health Initiative 2002 report. However, it's maybe making a comeback, but for now, it's generally only reserved for women where HRT is strongly indicated for additional reasons. So, for example, early menopause in younger women, where the risk of thromboembolism is more reduced. Related are the estrogen receptor modulators, specifically raloxifene, which is the sister of tamoxifen. So this chart shows how raloxifene and tamoxifen have different activity on estrogen receptors in different locations. Raloxifene and tamoxifen have estrogenic activity on the bone, but blocks breast estrogen receptors. But for osteoporosis specifically, you are more likely to see raloxifene. Tamoxifen is used more for breast cancer treatments. Raloxifene is licensed for osteoporosis therapy in postmenopausal women who are high risk of getting breast cancer. So, for example, if they have one or more close relatives with breast cancer. Otherwise, raloxifene is not as effective as estrogen, HRT, or bisphosphonates for fracture prevention, particularly at the hip. Both raloxifene and tamoxifen are associated with thromboembolism similar to the estrogens. That's it for this video on estrogen, HRT, and estrogen receptor modulators for the treatment of osteoporosis. Hope it was helpful, and check out the other videos in my osteoporosis video series.